Assalamu alaikum. Hello, everybody. So I'm Dr. Adeela Arooj, Fatma Jinnah Medical University alumni from North America. I'm a family physician working in Ontario, Canada. I'm a lead family physician at Henry Medical Center. I am also serving as an assistant clinical professor at McMaster University, and I'm a member of Joint Center of Bioethics at University of Toronto, Ontario. Thanks a lot for giving me this opportunity to talk on this platform. I am very emotional and I feel very satisfied that I'm serving my mother institution, which is Fatma Jinnah Medical College. And it's my privilege to talk on this platform and serve my alma mater. Today I'm going to talk about lung cancer, its common symptoms, prevention, and screening. So first of all, I would like to tell you what's the incidence of the lung cancer. So unfortunately, it's one of the commonest cause of mortality all over the world. Mortality means the death rate. It's second most commonest cancer. The lifetime chances of getting lung cancer is about 1 in 15 in men and 1 in 17 in women. Unfortunately, by the time the cancer is diagnosed, it's generally too late. That's why the mortality is high. The mortality is about 18 to 20%. The 5-year survival rate is very low. And generally it's diagnosed in elderly people, but sometimes it can even be found in younger people as well, and sometimes we don't find a cause of it. So I will be talking about its types now. So there are two main type of the lung cancers, but of course it can be metastasis, means a spread from another cancer like liver cancer, pancreatic cancer, colon cancer. They can all spread towards the lung. The commonest types of the lung cancer are non-small cell lung cancer, which is the most common type. It is a slow growing and has a better prognosis. Prognosis means that the chances to live, right? The other one is called small cell lung cancer. It is less common, but it spreads very fast and that's why it has the prognosis is not very good. So I will be talking about its causes now. The common causes of the lung cancer are smoking. In 80% of the individual who gets lung cancer are the one who smoke. So it's a habit which can easily be worked up on, right? So it's a leading cause of the death, and the most commonest thing is kind of smoking. So I think people who are smoking should take it really serious and think about quit smoking. So active smokers are the one who get, but sometimes even the passive smoker, means people who are exposed to secondhand smoke, are also culprit, right? So the smoking, like active and passive, both should be avoided. Then there are certain non-smoker who also get it. One of them are the passive smoker, and the other are people who are exposed to certain environmental factors. Radon gas is one of the commonest cause. So radon is a gas which is basically produced under the soil, and then from the cracks, when the soil and the water is mixed from the cracks in your basement, it can come up and can give can give lung cancer, right? And then asbestos is a mineral which is found in people who are working in factories. Arsenic, then pollution, right? Dirty environment can always cause damage to your lungs. So especially smoke in our countries now, in Pakistan and especially in Lahore, I recently found that there was so much of smoke during my recent visit. So smoke is also one of the factor. Then of course family history, genetic history is important, and we talked about that people can get lung cancer from other parts of the body, like secondaries from other parts is also one of the cause. We will be now talking about what are the common symptoms of lung cancer. So the most commonest symptom which people present with is cough, right? Persistent cough. There can be chest pain. It can be shortness of breath. You feel very winded when you walk. Fatigue, Tiredness is another symptom. Hemoptysis, which means blood in the sputum. So if somebody found there is blood in their sputum, in their phlegm, they should definitely talk to their doctor. Loss of weight, changes in voice, bone pains, some lymph node swellings means the glands, they swells up in your neck area. Even people can present suddenly with a blood clot when it is a late stage. And these are some of the symptoms. Then fever, right? Having night sweats, like very much sweating, loss of weight are all the symptoms of a cancer. If somebody is having these symptoms, they should definitely talk to their doctor and should be worked up. I will be talking about now, it's the test and the diagnosis, that how is it diagnosed, right? So we have different ways people present. So the most important thing is when somebody is coming to you, you talk to your doctor, we take the history, and we try to find out what symptoms are being presented, what is the medical problem, have the people smoked or they haven't, and according to that, we order different kind of tests, right? So of course physical examination is also really important here. Chest x-ray is a very common, the first line investigations which we order if somebody is coming with a persistent cough, shortness of breath, or some blood in their sputum. Bronchoscopy is like a test where we put a camera down the throat, and through there we go into the lungs, the upper part of the lungs. Sometimes we do take biopsy as well to diagnose that one. So these are some tests. And then CT scan can be ordered as well if we found there are some indication on a chest x-rays, right? So these are some of the common tests which are ordered. I want to talk about prevention and screening now, which should be our main goal. That why don't we take steps to control the cancer before it appears, right? So the first thing is smoking cessation, right? Quitting smoking is the most important factor which every smoker should think about. So the sooner you quit, the better it is. So there are different ways of quitting smoking. Like, you definitely should talk to your healthcare provider and your doctor to get help. Some people have willpower and they can quit smoking cold turkey. There can be some people need help, like nicotine replacement therapy is a one form where we give them nicotine patches, we give them nicotine gums and stuff like that, which helps. There are some medication which helps to quitting smoking. For example, Champax is one of that. When you smoke and you take medication together, you don't like the taste of smoke, so that helps in quitting smoking. So that is another way of doing that. And then the second factor is avoid secondhand smoke. So if you are a smoker, love your care about your loved ones and go out and smoke in an open environment rather than smoking inside the bedrooms or inside the house. So this is also really important. Then also try to avoid pollution, grow more trees, right? Have a healthy environment. Exercise, eating healthy, eating a balanced food, drinking lots of water, they all are helpful. Having a healthy lifestyle. Then avoid radon gas, like people especially who are living in North America or where closed houses with basements, they should check the radon level. Factory workers should take all the precautions as suggested by their occupational health, wear masks if possible. So these are some ways where we can prevent the cancer. I will be talking about screening. So unfortunately, we don't have clear-cut guidelines about lung cancer screening in most of the countries. It's a gray area, unlike like cervical cancer screening where pap smear is available, colon cancer screening where stool tests are available. We don't have like clear guidelines, but there are some guidelines which are evolving recently, and one of that is by doing a low dose CT scan. By that I mean that people who are smokers, who have smoked for about 20 years, who have 20 years history, 20 packed year history of smoking, they from the age of 55 to 75 should start screening with low dose CT scan. So by packed 20 years of packed years of smoking, I mean that a person who has been smoking 20 cigarettes a day for continuously 20 years mean he has smoked 20 packed years. So those people are more vulnerable to get lung cancer. So after 50, in some countries, and in some countries it's 55, they should be getting a low dose CT scan consecutively every year for 3 years, and after that the interval can be reduced to every 2 to 3 years depending upon which country are they residing. So I think in Pakistan also, if you are a healthcare provider and you're meeting a person who is a smoker and who has smoked 20 cigarettes a day for 20 years or 40 cigarettes a day even for 10 years, they are at a high risk, right? So I would encourage our healthcare professional to start thinking about that, and if somebody can afford it, definitely should go for it. So we will be talking about the treatment now. So treatment also depends upon the age of the person, the goals of the care, the type of the cancer. Is it presented in early stage, late stage? Is it a non-small cell lung cancer or small cell lung cancer, right? So we have different ways of treating. For example, surgery. Surgery means that we can remove either a part of the lung or the whole lung or the lining of the lung depending upon where the cancer is. Chemotherapy is also a very common way of treating lung cancer. There are different kind of chemos depending upon the type of the cancer and the stage of the cancer. Then we have radiation therapy as well available, where we just target the cancer and we try to give radiation, and it depends upon, it's usually like late stage cancers are treated with radiation therapy. Then we have targeted therapy as well, and some genetic therapies, and we also have something called an immunotherapy available nowadays, right? So immunotherapy is where the chemotherapy and the targeted therapy, which do not help, then we think about the immunotherapy as well for advanced cancers or metastatic cancer. So I think that's all for today. And once again, thank you very much for providing me this opportunity. And we will keep on doing what we are doing. And I want everybody to stay safe and take care of yourself. Allah Hafiz.